Yolander, and I'm doing my presentation on macrophage activation syndrome, or MAS, and its effect on the immune system. So, an introduction to MAS is that it is a disorder of the immune system, is potentially fatal and life-threatening, so it can be very scary. But thankfully, it's a rare condition. But at the same time, that's bad because there's a lack of general knowledge about it, and even specialists have limited experience with it, so it can be difficult to diagnose. So on that ominous note, let's get into what MAS really is. A quick overview of the immune system is that it is a combination of the lymphatic and the cardiovascular systems. It is not its own anatomical system within the body, so it uses the entire lymphatic system and then the blood of the cardiovascular system. So the lymphatic system matures the lymphocytes, which I'll explain in a minute, and it filters lymph, so it filters the invaders out of the lymph. And then the purpose of the immune system in the blood is to attack and eliminate foreign invaders like viruses and bacteria. And the main types of immune system cells include something called white blood cells, and those have something called monocytes, which are called macrophages once they leave the bloodstream. Macrophages are cells that perform phagocytosis, so they go around engulfing things that don't belong in the blood. And we want to remember those as we go into this. Lymphocytes are T cells and B cells. T cells are the cells that respond to B cell signals to go and kill invading cells, and those are important as well. Normally, the T cells and macrophages keep us healthy. They kill the right things, engulf the right things, and all is well. But then things go awry in MAS, and the macrophages and T cells proliferate and activate excessively and do their job too well. So that starts a cytokine storm, which causes massive systemic inflammation, which is inflammation throughout the entire body. And so instead of the immune system just attacking the little spots that it should, it attacks the entire body. And then cytopenias of other immune system cells happen because the macrophages and T cells start killing even the good cells. And obviously that is not good either. Signs and symptoms of MAS are hard to diagnose because they are rather vague and can point to a lot of different things. But the International Histiocyte Society has created a criteria where at least 5 of the 8 listed symptoms have to be demonstrated to diagnose for MAS. So those include persistent fever, hyperferritinemia, hypofibrinogenemia, which are both levels you can test for in the blood, the splenomegaly, which is an enlarged spleen, 2 of the 3 cytopenias here, hemophagocytosis in the bone marrow, lower absent natural killer cell activity, and then increased levels of a certain cytokine. So 5 out of the 8 of these have to be present to diagnose for MAS. There are a lot of other symptoms that can occur, but those are also equally as vague, so they don't help with diagnosing. Things like seizures, swelling, swollen lymph nodes, pain, rashes. So really it is difficult to diagnose, and unfortunately a lot of people go undiagnosed. So the prolonged persistent fever, pain, edema, those are all because of the inflammation that is throughout the body. The enlarged organs and enlarged lymph nodes are because there are too many of the T cells and macrophages in the body. And then these 3 longer symptoms are because the T cells and macrophages are going berserk and doing their job too much. And that all leads to essentially the immune system setting the body on fire. So it is very serious, and unfortunately it can lead to death. MAS is always serious, and it can be fatal. So what causes this fire? Why does this happen? To put it simply, doctors don't exactly know. The trigger can be suggested, but it's difficult to pinpoint what exactly starts the whole thing. It can be associated with a previously existing rheumatic disease, or an infectious trigger, like a virus that starts the immune system attacking it, and then it starts attacking the entire body. But it can also develop in patients without any pre-existing conditions, and so it's really hard to know exactly what causes it. But treatment of MAS is the same regardless of what starts it. There is a debate on what the best treatment is. One of the options is immunosuppressants like cyclosporin and prednisone, combined with Kineret, which is actually an arthritis drug, but they have been highly effective together. The Kineret reduces the inflammation And like I said, the other ones suppress the immune system, so together they just calm the immune system down and force it to chill out, basically. The other option is chemo and a bone marrow transplant, which is the harshest option and should be the last resort, because nobody should go through chemo if they don't have to. Essentially, it resets the immune system by killing the old cells and then replacing them with new ones. But Kineret has been more effective as well, so should be used more often. In conclusion, MAS is scary and dangerous, but thankfully it is treatable if it is diagnosed in time. Some people who are diagnosed and treated may not still make it, but thankfully it's rare. Even though it's difficult to know exactly how many people suffer from it, because it's hard to diagnose, it is rare, and so it's not a huge concern. If someone is sick with the signs and symptoms that we talked about, suggest MAS if the doctors don't know what's going on. It is hard to diagnose, and most people are just not aware of it. So it might be what's wrong, it might not be, but you may help save someone's life because of just speaking up. So thank you for listening to my presentation on MAS.